Whenever I see your smiling face, I have to smile myself because I love you.
Welcome back. You're listening to Your Dental Health with Dr. Margaret Ames. My guest today is Dr. Olga Isaeva. We call her Dr. Olga because her last name is a little bit too cumbersome. She's joined me, and first of all, we're going to have a guest. I asked a patient who came in, found me on the internet, and I asked him to join us. So I was really happy when he called and he came in today. I asked him just to talk about his experience. So his name is Thomas Cox. Welcome, Tom.
Thank you. Glad to be here.
Thank you. So you're all the way in Brooklyn now, huh?
I'm in Brooklyn. It was quite a ride out there, 1 subway and 3 trains, but it was well worth it. And I'm really very happy that I found you, Dr. Ames.
That's great. What was your past experience? Why were you looking for something new?
Well, it's that difficult to describe personal connection that is really the most valuable to me. I just felt that I wasn't really getting much attention, and I just found myself delaying appointments longer and longer. And then I chipped a tooth, and I thought I better find something. And without really having much confidence, I started looking on the internet, and I came to your site as an alternative to getting the traditional crown. And the more I looked at your site, the more I liked what I was finding. And really, I'm very skeptical in going through the internet and finding information that way. But your site really impressed me. And then when I talked to you by telephone, I was more impressed. And then when I went out there, I was really sold on your whole experience there, your treatment and your office and your staff and the time you took and the way we got to know each other. And then, that I've never had an examination like that in my life, so extensive. I was pleased with that, and then so I'm really ready to go ahead with the next step.
Great, and we don't have to cut away that whole tooth number 12 that normally would be cut away for a crown. We're going to rebuild that biomimetically.
That makes a lot of sense to me. That was my starting point. That's what I felt just intuitively, that I thought, there has to be something better today. And these crowns had their time, I'm sure, but metal and porcelain are not the only materials that are available to dentists today. And I'm glad that you're really up on techniques and materials that make a lot more sense. That flexibility of a tooth also resonated with me, that teeth are not the hard objects that you might think at first glance, that they're really living matter.
You sound more like an engineer than the artist that you are. You're really smart. Just to not to keep you too long, but the one thing that I said that I really appreciated most, because it's really what we're all about in my office, you expressed a trait that you liked about how you felt in the office. What was that?
It's trust. I really thought that was just about impossible to find. I really thought that I would have to resign myself to a competent dentist that I thought was giving me something of a fair deal, but not somebody who I could really get to know and actually trust what they were saying. So that's really the biggest factor of all. And I'm already planning to send my wife out there to see you. She's here with me, and she's laughing a little as I say that, because we're just finding out about this together. But then I really trust you, and I'm ready to take that next step.
Well, that's great. Well, thank you for coming. Thank you for joining us today on the radio. And I will say goodbye for now. I'll resume with Dr. Olga, and I will see you soon. And your wife.
Great.
Okay.
Thank you very much, Dr. Ames.
Thank you, Tom.
Bye.
Okay. Bye-bye now. So a testimonial, I mean, I just couldn't resist that because that trust word is so big, and we do strive to be open and honest and take the time that it takes to have you understand what the processes are and preserve all your tooth structure. So in the first part of the show, we were talking to Dr. Olga about her experiences and why she became a biomimetic dentist. We both have lives before biomimetic dentistry, which is one of the reasons that we embraced biomimetic, because we saw that we were cutting away too much tooth structure. Dr. Olga was in a practice where there was
a
tell
lot
us.
of crowns, a lot of root canals, and it was mainly insurance-based practice, and it just made sense to patient to use their benefits at that point. But once I can offer something better, I can explain it, just like in case of Thomas Cox. He understands it. If you sit down and explain, if the patient comes in and half of the tooth is missing, patient's first reaction, well, can you rebuild it? And most of the dentists would say, no, I have to remove the other part of the tooth and put a crown over it. And patients don't like to hear it, but unfortunately that's still what's been taught traditionally. And the biomimetic approach is totally different. It's a paradigm shift. You pretty much preserve what you have, and you build it up, and you save the precious tooth structure.
And we know this is not a fad. I mean, the dentists that are doing crowns and root canals and they don't know any better, they're doing the best that they know how. So we have to say that they really are doing the best. We would like them all to be learning biomimetic dentistry. It is so founded, but that's what thrills me is when Dr. Alleman teaches it, he spends half the time reviewing the research from all over the world. So we know this isn't just a fad thing, like, oh, we're trying this out this month, because a lot of times things are sold to dentists like, oh, try this, and then that goes by the wayside.
Sure, and he has, he was just on your show recently, was it 25 years clinical studies that the things that he placed in the mouth, they're still there.
Yeah.
And that's amazing. That's more than silver mercury amalgam fillings, elastin, or crowns. So this is great. And I think this show, just you doing this, bringing awareness about biomimetic dentistry and alternative treatments, it's such a gift. I'm sure that people hear about it, their dentists will hear about it, and the chain reaction have to take place. And finally, we can provide something more natural to our patients.
Have you heard of the concept of the 100th monkey?
Oh, yeah.
Yeah, so I'm hoping that this show is the 100th monkey, and it turns everybody into saying, I want it done biomimedically.
Right.
You did bring up insurance. I wanted to bring up a concept to patients that a lot of people that are lucky enough to have their employer give them dental insurance, the typical maximum is $1,500 a year.
Mm-hmm.
Back in the 60s, that covered your whole mouth, and they never raised that annual gift. So it's still $1,500 a year, but if you haven't used it, you should really get in, call us, and come in, and we'll take care of you. You don't want to lose that benefit that your employer has so lovingly given to you, because it is big. They're spending money for that insurance. According to Evelyn Ireland, the executive director of the National Association of Dental Plans, fewer than 5% of people with dental coverage hit their annual maximum.
Mm-hmm.
So, but we're working for you. We're not working for the insurance company. We're working to make sure that you keep your teeth, because the cheapest thing for you to do is get dentures. But it's the most expensive in the long run, because the dentures don't fit. They flop around. So if you do you expect that you're going to have any more root canals, or are we going to take care of this?
Well, definitely not. It feels so natural. Whatever we did so far, I was just amazed, because I did have some pressure sensitivity, a little cold sensitivity, and as soon as the filling was changed out to biomimetic bonding, everything went away. So thank God I did it on time, and that's another thing. Biomimetic dentistry is geared towards prevention, so this is very important. If you come in with an abscess and the tooth is already dying, it's very hard to prevent a root canal once the infection reaches the nerve. and we'd be more than happy to do it. But at this point, if the tooth is infected, it's hard. So do it on time. Don't wait till pain starts. If you have some chipping teeth, if you have pressure sensitivity, come in and we'll get you on the right track.
That's great. It's so, I have to tell you now, so we have this down on tape. Hopefully the show is being recorded now.
Oh, yeah.
That is such a pleasure, and I'm so glad that you came into my life, because when you're out there alone, sometimes you question and you say, is this worth it? I want to do this. I want all the patients to have this. And to have you come in and work together and have a second opinion for patients right there. Whenever I see your smiling face, I have to say I love you.
The song is about me. Thank you so much. Well, it's a pleasure, and thank you for sharing my story.
Thank you. So you can find more about Dr. Olga's holistic dentistry at www.naturesdental.net, and you can find me at www.drames.com. That's DRAMES.com. Look forward to talking with you next week. Please call my office, 261-4525, 261-4525. Have a great week.
Thought I was in love a couple of times before.